Endochondral. The endochondral ossification bone develops with replacement of a hyaline cartilage matrix. This hyaline cartilage matrix is surrounded by a pericardium. This perichondrium is what will continue to develop into the periosteum of the bone. Cartilage does not necessarily become bone itself, but what happens is that it acts as a scaffold or a blueprint upon which the osteoblast will develop into the bone. Endochondral ossification takes much longer than intermembranous ossification and leads to the development of the appendicular skeleton. In general, we discuss this through a 5-stage development. The first stage is where we have the mesenchymal cells differentiating into the chondrocytes. The second step is where the cartilage model becomes the future bony skeleton and the perichondrium forms. Capillaries penetrate this cartilage, which initiates the change of the cartilaginous to an ossified matrix through the development of trabecular bone within the primary ossification center. At this point, the periosteal collar develops to the periphery within the mid-body region of the bone, and the perichondrium during this phase transforms into the periosteum. Next, the cartilage and the chondrocytes continue to grow ends of the bone, leading to elongation of the bone, with the periosteal collar and cortical bone spreading towards the proximal and distal ends of the bone within the elongation. In the elongating region, a secondary ossification center develops. The bones form similar to the formation of the primary ossification center. At the end of the process, any cartilage remains is at the epiphyseum and will develop into the epiphyseal plate, leading to secondary growth during juvenile development. And at the end, or at the junction between bones, which forms the articular cartilage.